Elekta's comprehensive motion management is the next generation of MR-guided radiotherapy, where we are using 3D information of MR images to guide our treatment, including gating, non-gating, and breath hold. Clearly, the big advantage is the higher soft tissue contrast, and also that we have an independent imaging system compared to the linear accelerator. So we can imaging the patient while we are irradiating as well.
Here you see it live happening, you see the patient breathing, you see the heart beating, you see the bowels moving. So you really see everything happening as it unfolds at the moment itself. So that's quite impressive. What I liked the most at first was that we don't have to put fiducials anymore in prostate, in liver lesions, which makes the organization a lot more easier. If the anatomy changes, if the patient moves, two things can happen. Either it's a respiratory motion and something is coming back, so we define a boundary, define a level of that we're comfortable with. For example, we want 95 or 100% of the target within your boundary all of the time. And if it goes below the threshold, the beam shuts off. So for respiratory motion, that's very nice. So something that can happen during treatment is intrafraction drift. So it means that the lesion that you're treating is moving in a systematic way. And what's quite nice about the intrafraction drift correction is that you can really adapt to it in meantime. So if you see it happening, you don't have to replan everything. You can just move your plan a little bit and treat on that. Also, if it happens in the middle of your fraction. So our margin's much more tighter, and therefore we can, with the same prescription dose, we can deliver much more higher doses to the tumor itself while avoiding the onset risk.
When we started the quality assurance for the CMM, we were trying to put like very weird motions for the phantoms. It was also seeing that, okay, the algorithm is predicting and also stopping in an unexpected situations. So we were like quite confident that we can repeat the same thing even when the patient is less cooperative with the treatment. So in all words, CMM is giving us a really good confidence for latency compensation and for breathing motion. Working with Unity and also with CMM, it's quite fascinating. It's quite empowering because we think about a lot how we can improve every day, but this is also rewarding in another sense as well because we see the beneficial changes that we make every day.